Hello everyone, welcome back to my YouTube channel. So today we will talk about what is MLT in deep. If you are an MLT student, prepare for Viva interviews, exams, simply want to understand what is MLT in this video. So we will cover MLT, their importance, the laboratory departments, their instruments, quality assurance, their safety, career opportunities, their scope. So without wasting any time, let's get started. So what is MLT? Medical laboratory technology is one of the most important fields in healthcare. Doctor treats patients before treatment they need accurate laboratory reports. That's why medical laboratory technologists play a very important role. सिंपल हम ये कह सकते हैं कि मेन अगर समझे तो एमएलटी का बैकबोन है एमएलटी एक हेल्थ केयर का बैकबोन है हम लेबोरेटरी में पेशेंट के सैंपल टेस्ट करते हैं और डॉक्टर्स को एक्यूरेट रिपोर्ट्स प्रोवाइड करते हैं So, in the introduction, almost every disease diagnosed depends on laboratory investigations, whether it is diabetes, thyroid disorders, kidney disorders, infections, or cancer. Laboratory tests help doctors to confirm the disease. Laboratory reports are also used for treatment, monitoring, and disease prevention. मतलब सिर्फ डिजीज डायग्नोज करना ही नहीं बल्कि पेशेंट की ट्रीटमेंट चल रही है या इम्प्रूव हो रही है या नहीं ये भी लेबोरेटरी रिपोर्ट्स से ही पता चलता है सो व्हाट इज हिस्ट्री नाउ लेट्स look at the history in the 1670s Anton van Leeuwenhoek invented the microscope later Louis Pasteur introduced the germ theory today the modern laboratories use automated analyzers and molecular diagnostics and the Carl Landster discovered the AVO blood group system. यानी लेबोरेटरी साइंस कॉन्टिन्यूसली डेवलप होती गई है और आज ऑटोमेशन और एआई तक पहुंच चुकी है So I already told about MLT, but again I will talk about it is the science of performing laboratory investigations on clinical samples. These investigations help doctors diagnose, monitor and treat diseases. इसमें एक MLT प्रोफेशनल ब्लड, यूरिन, स्टूल, स्पूटम और दूसरे क्लिनिकल सैंपल्स को एनालाइज करता है. So, importance of MLT. More than 70% of medical decisions depend on laboratory reports. Examples as blood glucose for diabetes, HbA1c for monitoring the sugar, liver function test, kidney function test, tumor markers. इसीलिए लेबोरेटरी को हेल्थ केयर का बैकबोन कहा जाता है. So, next is role of the MLT. There are three important phases. First is pre-analytical phase, patient identification, sample collection and transportation. Now, second is analytical phase, which is testing, quality control, and instrument operation. The third is post-analytical phase, in which result verification and reporting is included. ये तीन phases सबसे important होते हैं क्योंकि error किसी भी stage पर आ सकता है. So we will talk about major divisions. Medical laboratory technology has different departments. These include hematology, clinical biochemistry, microbiology, histopathology, immunology. हर डिपार्टमेंट का अपना अपना अलग रोल होता है. फर्स्ट वी विल टॉक अबाउट व्हाट इज हेमेटोलॉजी. Hematology deals with blood. Here we study about red blood cells, RBCs, WBCs, white blood cells, platelets, and hemoglobin. And the most common test is CBC, complete blood count. CBC से अनीमिया, ल्यूकीमिया, इन्फेक्शंस जो भी होते हैं जैसे कंडीशंस डायग्नोस की जाती हैं. So next is clinical biochemistry. This is my favorite department because it deals with the biochemical analysis and I also did my master's MLT in clinical biochemistry. So important tests include glucose, HbA1c, creatinine, urea, lipid profile, LFT, TSH और भी बहुत सारे. ये टेस्ट डायबिटीज, किडनी डिजीज, थायराइड डिसऑर्डर्स और लिवर डिसऑर्डर्स को डायग्नोज करने में हेल्प करते हैं। नेक्स्ट इज माइक्रोबायोलॉजी. This department studies about microorganisms. It includes bacteria, viruses, fungi, and parasites. Culture and sensitivity tests help doctors for the selection for the correct antibiotic. यानी इन्फेक्शन किस ऑर्गेनिज्म की वजह से हुई है और कौन सी एंटीबायोटिक इफेक्टिव होती है. सो नेक्स्ट इज हिस्टोपैथोलॉजी. Histopathology studies tissues under the microscope. Biopsy samples are processed and stained using H&E stain. It is mainly used for cancer diagnosis. It means biopsy के through cancer confirm किया जा सकता है. So we will talk about immunology and serology. This department studies immune responses जिसमें टेस्ट इंक्लूड होता है HIV, HPSAG, CRP, ANA, डेंगू. मीन्स ये टेस्ट इन्फेक्शन और ऑटो इम्यून डिजीजेस डिटेक्ट करने में हेल्प करते हैं. So what are the clinical samples? Different tests require different clinical samples as blood, urine, stools, sputum, CSF. जिसमें प्रॉपर कलेक्शन और लेबलिंग बहुत इंपॉर्टेंट होती है वरना रिजल्ट्स इनएक्यूरेट भी आ सकते हैं. Now we will talk about what are the laboratory equipments. So we have the laboratory equipments, microscope, centrifuge, spectrophotometer, micropipette, photoanalyzer. So first we will talk about microscope and centrifuge. The microscope help us observe cells and microorganisms. The centrifuge separates plasma और serum from the blood. ये दोनों इंस्ट्रूमेंट लेबोरेटरी के बेसिक और सबसे इम्पोर्टेंट इंस्ट्रूमेंट होते हैं. So now spectrophotometer and micropipette. Spectrophotometer measures light absorbance during biochemical testing. Micropipettes transfer very small volume accurately. It means precision laboratory का सबसे important factor होता है. So we will talk about auto analyzer. Modern laboratories use automated analyzers. These machines reduce human error and increase speed and accuracy. जिसमें एक एनालाइजर एक दिन में हजारों सैंपल्स प्रोसेस कर सकता है. Quality assurance. Quality assurance ensures reliable laboratory results. It includes internal quality control, calibration, external quality assessment, enable accreditation, जिसमें क्वालिटी मेंटेन करना पेशेंट सेफ्टी के लिए बहुत ज़रूरी होता है. So laboratory safety. Laboratory safety protects both staff and patients. Always use PPE. Follow biosafety rules. Handle chemicals carefully. Dispose biomedical waste correctly. Safety फर्स्ट होनी चाहिए क्योंकि लेबोरेटरी में बायोलॉजिकल और केमिकल हजार्ड्स दोनों होते हैं. Career opportunities we already talk about in my previous video. After MLT, you can work in hospitals, diagnostic laboratories, blood banks, research institutes, pharmaceutical companies, teaching, quality management, government sector. MLT स्टूडेंट्स के लिए इंडिया और अब्रॉड दोनों में काफ़ी अपॉर्चुनिटीज अवेलेबल होती हैं. फ्यूचर स्कोप is very bright in this automation, AI, PCR, molecular diagnostic, digital pathology, personalized medicine. आने वाला टाइम में AI लेबोरेटरी प्रोफेशन को और भी एडवांस बनाने वाली है. So in the summary, I will say that MLT is the backbone of diagnosis. Without laboratory reports, doctors cannot make accurate clinical decisions. MLT professionalisms play a vital role in the patient care. So in the ending, thank you everyone watching for this video. I hope this presentation helped you understand medical laboratory technology in a very simple way. So if you found this video helpful, don't forget to like, share and subscribe to the channel. And all the press the notification bell so you never miss upcoming videos related to ML.